Goodness, there we
We
are.
got it to work.
I'm
Yay.
telling you, for some reason, getting it started is always the hardest thing. I'm like, I'm pushing the right buttons.
I'm
And
glad
I
you're the one in
really,
charge of that, not me.
yeah, I was going to say, it's totally me. I don't know what it is I'm doing wrong, but obviously something. But thank you so much. It only took 4 minutes, but here we are. So I appreciate you jumping on. I started talking and then I jumped off to see if that would help. So I'm jumping back on. And so very quickly, I'm going to introduce myself just in case you are jumping on and you're like, who are these ladies on my screen? My name is Karen Cerezo and I am a women's health coach and a menopause advocate, I like to call myself. And my goal is to just help women get educated so that they have more information so that they can make better decisions when it comes to their health. So one of the things that I love to do as an advocate is to talk to the experts. And so I'm so excited to have Dr. Amy join us today. So, Amy, will you kind of give us a little overview of who you are, what you do, who you service, and how you got into it all?
Well, I could talk for days on that. But
I was going to
yes,
say, so just three easy
just a
questions.
brief little thing. So I am a board certified urologist. And I was in traditional practice for over 20 years. I don't know if I'm getting a lot of feedback. I don't know if you're getting that, but
I'm not getting any.
okay. So and I have always taken care of men and women. And to be honest, for a long time, really what was available was more for men as far as like sexual health and hormones. And I, especially as I was starting to go through menopause, I became more interested in what we can do for women for hormones, not just for sexual health, but also for hormones. So I took it upon myself to get more training in menopause care, which was severely wrong. We just don't have one area of medicine that is really assigned that task. And so it's really become more the people who are interested, varying fields, that have taken it on. So I took it on and I left my traditional practice. I opened up a private practice. I'm licensed in Texas, obviously Michigan and New York. And I see patients virtually, obviously, if I'm in 3 different states.
Yeah.
And it's a concierge practice, so I can spend more time and really get to know people and dig into the details and get to know who they are, what their expectations are, what they're experiencing, and troubleshoot. And
Yeah.
so by having hour-long appointments, I can really dig in. And with my background, not only do I see the women in menopause, but I see all genders. So some of my patients are married couples where I see the husband for sexual health and hormones, and I also see the woman. And so it's nice because I can kind of take care of the whole couple if they are a couple.
Yeah.
It gives a different perspective that a lot of times you just don't get.
Yeah, and I do notice a lot of my clients that come to me and just girlfriends that I talk to, people that I run into at events, unfortunately, because the way insurance and the way you are very restricted and what you can do and what codes and how much you can spend with us and time wise, so many women are having to go out and look for these additional resources. But the nice thing is they are available, and it's so important that women understand you don't just have to accept that one option.
Absolutely.
There's other options out there. And the nice thing with virtual is now you are able to reach out and make connections with people that might not be in your neighborhood, but you're going to get that support. So
yeah. And I hear, a lot of times I'll hear people on social media or things like that, and they'll love to kind of bash other doctors or say, oh, your doctor did. I don't believe that really. I think that most of the doctors out there really are good and they want to help. But it's that restriction of an insurance-based practice that limits them a lot of times. It's not that they don't want to help; they're just as frustrated as the patients.
Yeah.
And so I don't, I can come in as a extra set of eyes, extra set of ears. I'm not replacing a primary care doctor. I'm not replacing your general gynecologist or urologist. I'm specializing in this one area that maybe needs a little more attention. And I'm not taking over for anybody, and I work with them. I work in conjunction with the other the other doctors and providers.
And we'll get into that in a second. But I do think that that's so important to realize is that I think we need it all the time. But I think this moment in time, very much like pregnancy, but there's something very special about menopause. And maybe it's just the lack of. But I think during this moment of time, in this transition that we're in, having those multiple tools in our tool belt is so important. So while it can be time consuming and a lot of energy, but to feel really good, sometimes we need to reach out to these different areas of specialty, because we are getting older. And so yes, it's important to be able to have all of those different options. And I love that you do all of that. Before I get into a couple of the questions that I already have ready for you, one of the things I wanted to know is you are really, I mean, you're in this profession. You've done this for years. When you started going through your own menopause journey, what surprised you the most?
Honestly, it's actually funny you asked that, because as much as I know about this stuff, there were things about myself that I didn't even recognize. I really started on hormones for myself mostly because of hot flashes.
Mm-hmm.
And I had for years, I had like various joint aches and pains. I didn't even like associate that with perimenopause or
Yeah.
menopause. I never even connected that, or that wasn't even on my radar of what I was trying to fix. And it wasn't until I'd been on my hormones for a few months, I was like, wait a minute, wait, I'm not having that anymore. And like for years, I'd been in perimenopause, and I think a lot of people don't realize how many years perimenopause can go on. And so they don't even associate these things because their periods are so regular, or they're on a continuous pill, or they have, an IUD, or who knows what, that they don't even necessarily associate it. And it really wasn't until I was actually already being treated that I realized that that problem was associated with it. And I improved it with my hormones. And I just
Yeah.
never, I almost felt silly that I, for myself, never made that connection.
Well, and I think that's probably one of the hardest things is connecting the dots. And there's so many reasons for that, right? Like one, we just don't have the information. We didn't have the list of symptoms. We knew when, during pregnancy or fertility, postpartum, we kind of knew what to look for.
Mm-hmm.
But with menopause, same thing. I was like, why do I have vertigo? Why do my joints ache? Why did my gut health change all of a sudden? There was like this whole list of things.
Yeah.
And of course, everybody chalks it up to, oh, it's stress, or, oh, you might have injured yourself at the gym. I had no idea why I had frozen shoulder. Didn't know it was frozen shoulder. I'm like, how did I injure myself? I haven't done anything crazy. And so we're just trying to put all these puzzle pieces together. So I love the fact that our generation is talking about it. And I think we have the luxury of social media, ways to connect. And I think that's so important that we are sharing this, and that we're saying we want support,
Mm-hmm.
and we want our doctors and we want these specialties to be educated so that we can ask these questions. And the way we do that is we just continue to share information. We share our stories, and we try to see, what works for you might not work for me, but at least I have better education of what I should be asking for.
Right.
So one of the questions I have for you, is it important for a woman during this time, whether she's in perimenopause or all the way postmenopause, is it important for us to have a urologist kind of on speed dial? Is that something that you're like, you should probably at least have, one meeting with a urologist, kind of like we do with a cardiologist?
Yeah.
Or
Not necessarily. I think that,
okay.
you know, especially for people who I'm seeing, that's an added, like, I love when you said about the toolbox, because I'm always talking about the tools we have and what I have in my tool belt. It's one of the
Mm-hmm.
tools. And
Okay.
so if someone has a trusted doctor that is well trained in menopause and they're addressing their issues, I'm also not someone that says you have to have every test in the book and you have to see every doctor in the book. I'm not looking to waste people's time and money. So
Yeah.
that adds to my perspective. And I think it's important to talk to someone about menopause. I think that's an important conversation to
Mm-hmm.
have. Does it have to be a urologist? Probably not. I mean, of course, I'd love to say yes. That's
Right,
me.
right.
But no, I think you need to have someone who's well educated in menopause care. It doesn't have to be a urologist. It doesn't have to be a gynecologist. It doesn't have to be a primary care doctor. It has to be someone who has educated themselves and has the information to impart and can guide you from there.
Yeah, I love that answer because I think we just have this fear of we're not doing enough, right? And I need to be
Mhm.
doing all of the things. And like you said, if you can find the one that's going to give you that solution, that's okay. Um,
Mhm.
how would you explain, because this is really a question for myself, how would you explain the difference of what you do as a urologist versus what a pelvic floor therapist does? Like, is there a lot of overlap between the two of you?
Absolutely. Yeah, absolutely. My pelvic floor therapists are like my favorite people. Okay. So, I mean, pelvic floor therapists, sex therapists, like all these other people in healthcare, the coaches, just all these people are so helpful because it's the broad picture. It's working collaboratively. And while I am able to diagnose and discuss and treat in some ways, I don't do pelvic floor therapy.
Okay.
So I need a good pelvic floor therapist for the people who need it. Not everyone does, but honestly, so many people do.
Mhm.
Um, you know, and so having a good pelvic floor therapist is huge. And I find that that's something we are getting better at. And I have the conversation a lot of time with patients. For some reason I feel like there's this like stigma or this bad rap that pelvic floor therapists get, where people think like, oh no, my doctor's sending me to a physical therapist or a pelvic floor therapist because they don't know what else to do. And I always explain to my patients, this is one of the first things I do. It's not that I don't know what else to do, it's that I know that we should do this. This is
Yeah.
not a cop out. This is one of the most important things we can do.
It is
And
crazy. Oh, go ahead.
and because I deal with the bladder and the pelvic floor so much, that I have always, I mean, my whole career, I have been, tied to my pelvic floor therapists.
Yeah, it's I was going to say it's so crazy. I never had a pelvic floor therapist discussion with other females or any I didn't know anything about it until just recently. I'd say, in the last 7, 10 years possibly. And
Yeah,
that's after having 3 kids. And I feel like we're one of the first world countries that doesn't talk about that after childbirth. And it absolutely is mind-boggling.
absolutely. One of the
Um,
pelvic floor therapists that I work with, we've had that discussion that like that should be like standard.
yes.
When a woman is pregnant, it should be standard. I don't care if they go full term. I don't care if they're C-section, vaginal delivery. I don't care if somebody has carried a child in their body, their pelvic floor has been affected.
Yes.
Postpartum, that should be like a standard of postpartum care.
Yeah.
And we just don't. It's
We
very rare.
we don't. And it's funny, my oldest just had a baby a couple months ago, and that was one of the things I said. If your doctor doesn't suggest this, I'm suggesting that you reach out to
Yeah.
somebody and make an appointment because it is so important.
Yeah.
And so you did mention a little bit about, urination and some of the things that pelvic floor
Mhm.
therapists can help with, but also what you can help with. So why do we have all of a sudden, I just read I love threads. So I was on threads and somebody had posted something, about I'm in menopause. One of the things I hate the most is I literally have to pee every 2 minutes. So
Mm.
what is it about the frequent urination, the urgency, the feels of urgency, or all of a sudden, leaking? I'm a fitness trainer, so all this, I have a lot of clients that are like, I'm opting out of jumping jacks today. So
It's
what
counting out.
happens? Yeah, what
Yeah.
happens there? Is it age? Is it pregnancy? Is it menopause?
Yes, 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 yes. It's all the above. And so there's so many components and it's not the same for everybody. But one of the things that's huge is pelvic floor therapy to help that. And, when we talk about hormones, we talk about systemic hormones. We also, which
Mm-hmm.
are through your whole body. We also
Mm-hmm.
talk about local hormones in the vulva and the vagina. There are estrogen receptors in the vulva, vagina, bladder, neck, urethra, etc. And so for a lot of times, for some women, for these bladder symptoms, adding a local vaginal estrogen may be all that they need to
Mm-hmm.
improve their urinary symptoms. So it's
Yeah.
not just, thinking about the systemic hormones, it's that local effect that is so important for so many women and it just doesn't get recognized. And so that hormone change plays a role in our bladder function as well.
Yeah, and I was going to say, so I've been talking about menopause for about 8 years now,
Mhm.
and 2 years ago I got to see Kelly Casperson speak, and she was talking about Why the negative effects of having chronic UTIs, especially on our older female population, and how that's almost like a death sentence for some women, and the difference between vaginal estrogen and regular estrogen, right? The creams, the pills, whatever you're using.
Right.
I was blown away. That was the first time I had ever heard anybody talk about that these are two different things. And since then, I have been preaching it to everybody. I'm
Yeah.
telling my mom, you need to get on this. I'm telling anybody that'll listen. I'm at HEB, the grocery store, and I'm like, are you taking vaginal estrogen,
Yeah.
ladies?
Yeah. Everyone raise your hands.
Right.
No. I will tell you that even in my own training early on, I don't know that I was ever taught that. And I've been prescribing vaginal estrogen forever.
Yeah.
Okay. And I will tell you that the data supporting vaginal estrogen, like I'm very, uh, I take it very seriously about like,
Mhm.
there's no promises, nothing's perfect, nothing's 100%. And vaginal estrogen is one of the few things that I will tell you has almost zero risk. There's
Yeah.
almost nobody who can't take it. Now, there are people that maybe can't tolerate it for one reason or another. They're a minority, and there's different
Mhm.
forms that we can give it if that's the case. But like, it's so safe. And all these patient populations that think, oh no, I was told I could never take,
Hormones.
estrogen.
Yeah.
They can take vaginal estrogen usually. And the data supporting the benefits is astounding.
Yeah.
Decreased recurrent UTIs, decreased hospitalizations, decreased sepsis, decreased
Yes.
death.
Yes. Nobody ties those two
It's
together.
crazy.
Yeah,
Yeah.
no, if you, the more you talk to people and ask about their grandmother, if they know about their grandmother's like health, and especially if they're in assisted care and they're sitting and, wet diapers or whatever it is, and then you start to get this information, it is mind blowing what happens to a
Mhm.
woman if you have those chronic UTIs. And so in, what was it, October of 2025, we removed the black box warning, and that was one of the things that this is safe. And so it's going to take some time for women to get the message. But
Yeah.
yes, I tell women that all the time, that yes, even if you have issues, if you've got, if you've had the conversation with your doctor about breast cancer, breast cancer awareness, whatever it is, where they're like, I can't take certain hormones, the vaginal estrogen completely different,
Yeah.
right?
And
Yeah.
I mean, I know we don't have that much time left, and I know that you promised that we were going to talk about sex. So I'm
Yeah.
going to take this opportunity to interject
Yes.
that in addition to preventing UTIs, the vaginal estrogen can be great for sex. It helps with the vaginal dryness, etc. And that's the part that more people actually do
Yeah.
know,
Yeah.
not the recurrent UTIs. But
Yeah.
I felt like I had to make sure I threw that in there because
Yes.
we promised some sex talk, and I couldn't leave that.
Yes. Yeah. We'll
So
definitely, we'll jump into
yeah,
that for a
we'll dig
second.
into that more.
But yes, I agree. Yes, it helps with, the tissue, and the everybody's out to get the collagen, right, for their face and
Right.
everything. But girl, that if you want collagen, that's going to help that tissue in the vulva, and yes, all that, all the good stuff there. So, okay, so that's a good one. I love that. And we will definitely get more into vaginal
All of it.
estrogen and different types of estrogen and things that you can do, to help with leakage, or that feeling of, that you're constantly feeling like you have to go pee, or that you do have to go pee. But let's get into a little bit of the sex talk. Why does it become so challenging? Why does it become painful? Why do women complain? And I was one of them at the very beginning. I was like, why is everything so dry and itchy? Why does it feel like I have paper cuts? Why do I feel like I have an STD? My poor husband was like, I did not give you an STD.
Do not
I'm
blame
like,
me.
why is everything hurting? Like, and I had no idea. I was like, what is going on? And I finally went to my doctor, told her all these things, and she's like, oh yeah, it's normal. And I'm like, but nobody told me, nobody warned me. And so, what exactly is happening, and what can we do about it?
So I don't love the word normal. Okay. So
Yes.
that's one of my pet peeves is the word normal because what's normal? Like it may not be unexpected, but that
Mm-hmm.
doesn't mean normal implies that you shouldn't or
You
can't
look.
or there's no way to fix it.
Yeah.
And as we get older and we have less estrogen, the vaginal and vulvar tissue changes and it gets thinner and drier and decreased blood flow. all these things. And so there are moisturizers we can use, there are lubricants we can use, and there's the vaginal estrogen. And
Mhm.
vaginal estrogen is the only one that really gets down on the cellular level that's making definitive change. That doesn't mean it can't be used in conjunction. You know, lubricant is your friend. I talk about it with people. Lubricant, lubricant, lubricant. There's no such thing as too much. Put a towel down. Don't worry about making a mess.
I
You
love that.
know, there's no such, you can't use too much. You can use too
Yeah.
little, but you can't use
Yeah.
too much. Um, Vaginal estrogen, again, it comes back to that. That vaginal estrogen is making those long-term changes. And that's another reason between the vaginal dryness and also it's not just about the sex, because I will have women that will tell me they're uncomfortable
Yeah.
or and they have the recurrent UTIs or they're just uncomfortable, not during
Yeah.
sex, just in general. And then I'll suggest vaginal estrogen and they've heard some of this and they'll say, oh, no, I'm not sexually active. So what?
I
First of
know.
all, it doesn't matter if you're sexually active with a partner or by yourself.
Right.
And it also doesn't matter if you're not sexually active at all and you're uncomfortable. Vaginal estrogen is beneficial for so many things. It doesn't have to be about sex.
Yeah. And
And
that's
it can
one of
help
the
with sex.
Well, right. And that's one of the things that, like, why they were not, I mean, obviously they had other reasons, but women in their 80s and 90s don't need vaginal estrogen. And I'm thinking, yes,
Right.
they do. Okay, maybe they're not active, which according to the statistics, they're pretty active in those senior
Oh, yeah.
homes. So,
Oh, yeah.
but they need it for other reasons. But we do see an uptick of separations and divorce during this time. And I do feel that some of it is the change in the relationship, the
Yeah.
dynamics. All of a sudden you wake up and you're like, who am I married to? But also, things happening in the bedroom can be fixed if you are in a position where you're like, I still want to be with my partner and I want to be intimate with my partner. And so I love that you bring that up.
And that's where I feel like, because I do see all genders,
Right.
you know, I see men and women, that's where we can bring it together. You know, my favorite thing is, you know, couples that I see where I'm seeing both. And not only am I seeing both, they sit in on each other's appointments.
Yeah. And it's
So we
having
have
those
the open
conversations.
communication and we
Yes.
talk about it for both of them because things are affecting the men too. And
Exactly.
so when we're helping a woman, part of my care is I'm very holistic. I look at the whole picture. Part of the whole picture is the other people in their lives. It's their home environment, it's their work environment, it's their community environment. That's part of it.
Yeah.
So if I can also address their partner, I'm taking care of them.
100%. Yeah, no, 100%. I think that's so important. I love that you can bring them together. Okay, one last question real quick. Since
Yeah.
you do treat men and women, um, you can prescribe testosterone, correct?
Yes.
And are there positives for women taking testosterone when it comes to vaginal health besides increased libido? Like, what other things are you seeing with
So
testosterone?
So, you know, the data with testosterone is a little difficult because we do have some promising things, but I'm always hesitant and careful because there is some data saying it can improve cognitive function, bone health, muscle, um, orgasm, sexual satisfaction, not just desire. But the strongest data right now is for desire.
Okay.
You know, we do also use some local testosterone for vaginal discomfort or vaginal pain, certain conditions. We do use that. The strongest data, though, really is, and a lot of the rest is off. It's really all off label because there are no products manufactured for women. We have to use either compounded
Yeah.
or just for men, and then we adjust dosing. So it is off label. So I do give that caveat. But for men and women, it is the right choice for them. It's not for everyone. Just like any of these options, we
Right.
individualize. It's all
Yeah.
about individualizing.
And the biggest thing is educating, right? Having those
Right.
conversations, letting them know these are your options and these are why we would choose these for you. And then ultimately, as the patient, we make that final decision.
Absolutely.
Okay,
Absolutely.
there's like 100 more questions I have for you. And so I'm so excited because you and I are going to actually take this conversation deeper and further. That sounds very sexual.
Yeah, that's what we're here for, right?
On July 28th, which is a Tuesday night. Is that right? Yes. I keep thinking today's Monday, so don't listen to me. July 28th, it is going to be at 6 p.m. Central Standard Time. And the cool thing is because you are in Michigan, we're going to do an optional. You can come and join me at a space where I will be in Round Rock, and we're going to have snacks and treats and yummy things. And you're going to join us virtually, or women that are not in the Round Rock, Texas area, then they can join virtually and get on the conversation. The other thing is when you register, we're going to send out a questionnaire so that you can get your questions answered by Dr. Amy. And it's all anonymous. I'm not going to say, hey, Susie from, St. Paul wants to know. We'll just kind of go through them anonymously. Here's some of the questions that women have, and we'll get those answered. So I'm super excited to do that. I will post the link so that you can get registered for that event. Is there anything you want to close out with before we say goodnight?
I would just say, please submit the questions. We love having those questions in advance so we can make sure we allow the time so we can really answer them for you. And I will promise to try to have better lighting for that, because clearly the lighting in my office is not adequate for this. I am not the social media pro that I should be for being virtual.
No. I think you look fantastic. It
Thank
has
you.
very nice. It has
Thank
very
you.
nice evening ambiance. But the
Oh,
most important
perfect.
thing is the conversations. I think
Yes.
ultimately, if you were in the dark and you still gave us these amazing tips, I'd be okay with that too. So
Maybe people feel more comfortable. They'll feel more anonymous if it's not as bright.
Don't look at me. Okay, so I will post that link, and then you can join us. Even if you are in the Round Rock area and you're like, I don't want to put out pants and leave the house, girl, I totally get it. Join us virtually. But I will post all of that, and I'm excited. Dr. Amy, I'll see you in about a week. Thank you for
Sounds
joining us
great.
today.
Thanks, everybody. Thank you.
Take care.
Bye-bye.